Okay. Yep.
Hello.
Hi.
My name is Morgan. I'm a physician assistant student. I'm going to be doing your cardiovascular exam.
Okay.
Right? Okay, so I'm going to start by having you lay back on the bed here. I have some pillows propped so you're at 30 degrees. And I'm going to be looking at your neck and jugular venous pressure. So I'm going to start by using my light, looking at both sides of your neck. So if you can look towards the window. Good, and now look towards me. Good. Okay, now look back towards the window. I'm gonna measure your JVP. First, I'm gonna find your sternal border here, and I'm gonna make a 90-degree angle with these cards at the point of oscillation of your jugular vein, and I see it really strongly right here. Okay. Okay, and now that should be measuring below 3 centimeters to be considered normal. Above would be elevated. But you were below 3 centimeters, so that was good.
Good.
Now I am going to feel your carotid arteries. So just breathe normally. I'm going to feel the other side. Good, okay, now I'm going to listen. And while I'm listening, hold your breath so I don't hear your breathing. I'm just listening to the blood. I'm listening for any bruits, which would indicate turbulent flow. Okay. Good. Okay, now I'm going to move on to your lungs. So if you can sit up towards the edge of the bed, and I'm going to start at your back. So right here we have your gown open. I'm going to be listening. When you feel my stethoscope move, just take a breath. Okay?
Yep.
Okay, good. Now I'm going to do the same thing on your chest. So, can you please lower your gown?
Mm-hmm.
We'll just be doing the same thing again.
Okay.
Okay. Good. Okay, so now I'm going to move on to your heart so you can lay back down at 30 degrees. Okay, so I'm going to start by inspecting your precordium. I'm looking for any apical impulse, heaves or lifts of your chest. Now I'm gonna use my hand. I'm feeling for any thrills at the base of your heart, sternal border, at the apex. Okay, now I'm going to feel your point of maximum impulse. So can you just roll over to your left side and going to feel where your heartbeat is the strongest. Okay, now you can lay back on your back, move these so you're more flat. Now I'm gonna measure the diameter of your apical impulse. It should be 1 to 2 centimeters, considered normal range. And then about 10 centimeters from your mid-sternal line is also normal. That lines up. Now I'm going to listen to your heart. So can you scooch up a little bit more so now you're elevated? Good. Okay. Just going to start on the right second intercostal space, listening to your aortic valve. And pulmonic. Second pulmonic, or Erb's point. Now tricuspid. And tricuspid. Now at your fifth intercostal space, midclavicular, I'm listening to your mitral valve. Okay? Now I'm going to do the same thing again using the bell of my stethoscope, okay? Aortic, pulmonic, second pulmonic, tricuspid, tricuspid, and mitral. Okay, now using the diaphragm, I'm going to compare to your carotid pulse, okay? Can you turn your neck that way? Thank you. Okay, that's good. Your carotid upstroke is right after S1, precedes S2. That's good. Now I'm going to have you scooch back up. Nope, just kidding. We're gonna have you roll onto your left side first to do some special maneuvers, listening for any murmurs. So first I'm gonna check your mitral valve or for any mitral stenosis or S3 or S4 sounds. Okay, you're good. Now I'm gonna have you sit up.
Okay.
We're gonna listen to your aortic valve. So first I'm gonna have you lean forward towards me and exhale and hold your exhale. And I'm just gonna be listening around your heart in the left sternal border. Okay, good. Okay. Take a breath. Now I'm going to listen for any hypertrophic cardiomyopathy. So I'm listening to your heart normal, and then I'm going to have you bear down and see if any sounds get louder while you do that. So just bear down when I tell you to.
Sure.
Okay? Good. There were no louder sounds.
That's
so
good.
It is good. Okay. Now I am going to do peripheral vascular, so you can put your gown back on
Okay.
so your chest isn't exposed. Okay, so I'm going to look at your upper and lower extremities. I'm looking for any swelling, looking for symmetry, same size. I'm seeing if you have any bruises or scars or rashes. And I'm looking for distribution of your hair, if you're losing any hair on your legs, or if you have any varicose veins. You don't? So now I'm going to check the temperature and texture of your arms and legs.
Mm-hmm.
So I'm just feeling your arms, the back of my hand, for temperature and then texture. Okay. And your legs. Temperature, texture. Okay. Now I'm going to get your pulse. I'm just going to be waiting 30 seconds. Okay. In 30 seconds, so your pulse is 60, which is good. Now I'm going to feel both of your pulses to make sure they're the same on both sides. Good. Okay, I'm going to get your popliteal pulse. Posterior tibial. And dorsalis pedis. Okay. Now I'm going to check for capillary refill, so I'm going to be squeezing your fingers and toes. Okay, and your finger. Good. Okay, now I'm going to check for any pitting edema. It's going to feel your shins. again, the dorsum of your foot, and behind your medial malleolus.